Unfortunately, vein disease, as we had indicated, is a chronic disorder. It's often necessary to consider all additional forms of therapy. Most of this is determined on the basis of your initial response to our first treatment. Multiple treatments may be necessary. We'd like to compress most therapies. Ideally, it would be best to have everything taken care of on day one. Very frequently, the complexity of your disease requires a need for numerous treatments. Our insurance carriers have limited us in terms of what can be done and what cannot be done. Very frequently, by doing one procedure, may limit the need for additional procedures, and that's the need for follow-up ultrasounds and repeat studies. That way, at the conclusion of the treatment, we know that we've covered all of your venous pathology and all of your venous disease.
People often ask about the pain of the procedure. Everybody's pain tolerance is different. I've had the procedure done and it really wasn't that bad, but I have a pretty high pain tolerance. You feel some of it, but we numb. We're very, very careful in numbing everything up so that you don't feel anything that you're not supposed to.
Your expectations in terms of pain are very limited. It obviously varies with individuals and the procedure that we perform. We anticipate a 3 to 5 day period of soreness, mild tenderness, most of which can be managed with mild anti-inflammatories. Occasionally, a phlebitis, which is a complication of our procedure, may need additional analgesics or pain medication. Compression therapy, along with continued activity, limits the number of your complaints.
Just because you feel better after your first procedure doesn't necessarily mean that the treatment's done.
Following your procedure, we outline a very carefully planned treatment. And the treatment often requires more than one procedure. Some of the procedures are brief, requiring simple needle injection with a sclerosing agent. Other times, given the complexity of your disease, requires additional procedures for completeness.
After any and all procedures, you're going to have a little bit of a tenderness, maybe some bruised feeling.
Most patients following their venous treatment improve significantly over a 2-week to 2-month period. Some folks demonstrate some mild soreness, but in a short period of time will notice a significant improvement in their sense of discomfort and heaviness. They may see a significant improvement in their lower extremity swelling. They may notice an improvement in their skin pigmentation. It's very variable and each patient responds a bit differently, but at the conclusion of our treatment strategy, we would anticipate a majority of our patients do very, very well.
The thing I like most about this practice is that yes, you see the nurse practitioner or the physician's assistant most of the time, but the doctor is very much involved.
The physician staff overview the entire study in addition to discussing with our nurse practitioner the results of your ultrasound. This enables us to draft an appropriate treatment plan that's tailored specifically for you.
One of the most frequently asked questions that we hear is, does insurance cover this? The short answer is yes, most of the time. Good thing is we have a financial team that looks over your benefits, looks over each ultrasound plan and then each insurance plan just to determine if what the doctor and I have drafted for you is covered by your insurance.
We have a team in each office that will take the treatment plan that was put together by Dr. Town and your provider. We take that, we get with your insurance company, and depending on your coverage, so that could be your deductible, your co-insurance, or copay, would be the determining factor what your out-of-pocket expense would be. Before you come in for the actual procedure, we would notify you and discuss that coverage with you in great detail. If for any reason you're unable to pay what you would owe out of pocket at the time of service, we do have several options that we could offer you so that you could still get the medical treatment that you need, but not feel that financial burden. We do offer something that's called Care Credit. It is a credit card strictly for medical bills. It's free to apply for, and we can do it in the office, and it takes just a matter of minutes. We have some other options that we could offer too if we need to do any type of in-house payment plans. But again, we do have financial teams at all locations that are more than happy to sit down and discuss with you what your insurance would cover and what your out-of-pocket expense would be, and to make sure that you're able to be treated medically.